Hey guys, welcome to Medifaction. So today we're going to learn about the physiology of basal ganglia. The basal ganglia or basal nuclei are a group of subcortical nuclei of varied origin. These are seen on the brains of vertebrates, that means including humans. This is situated at the base of the forebrain and top of midbrain. Now, in order to learn more about it, let's go further. In this video, I'm going to enumerate an introduction about basal ganglia. We're also going to discuss the components of basal ganglia, which are corpus striatum, substantia nigra, subthalamic nucleus of Leys. We're also going to discuss the functions of basal ganglia, in which the control of basal ganglia over the muscle tone, motor activity, reflex muscular activity, automatic associated movements, and the role of basal ganglia in arousal mechanism and the role of neurotransmitters for basal ganglia to function will be discussed. And also some important applied physiologies will be discussed, which includes Parkinson disease, Wilson disease, chorea, athetosis, chorioathetosis, Huntington chorea, hemibalismus, and kernicterus. So let's begin. Introduction. Basal ganglia are the scattered masses of grey matter submerged in the subcortical substance of cerebral hemisphere. Basal ganglia form the part of extrapyramidal system which is concerned with motor activities. Components of basal ganglia. Basal ganglia include three primary components. Number 1, corpus striatum. Number 2 is substantia nigra. Number 3, subthalamic nucleus of Leys. Corpus striatum. Corpus striatum is a mass of grey matter situated at the base of cerebral hemisphere in close relation to thalamus. Corpus striatum is incompletely divided into two parts by internal capsule. Number 1 is caudate nucleus and number 2 is lenticular nucleus. Let's go deeper. Caudate nucleus. This right here is the caudate nucleus. So, caudate nucleus is an elongated arched grey matter lying medial to internal capsule. Throughout its length, the caudate nucleus is related to lateral ventricle. Caudate nucleus has a head portion right here and a tail portion. Head is bulged into lateral ventricle and situated rostral to thalamus. This is the thalamus. The tail is long and arched. It extends along the dorsolateral surface of thalamus and ends in amygdaloid nucleus. Now let's talk about the lenticular nucleus. Lenticular nucleus is a wedge-shaped grey mass situated lateral to internal capsule. A vertical plate of white matter called external medullary lamina divides lenticular nucleus into two portions. The outer putamen right here and the inner globus pallidus. Putamen and caudate nucleus are the phylogenetically newer parts of corpus striatum, and these two parts are together called neostriatum or striatum. Globus pallidus right here is phylogenetically older part of corpus striatum, and it is therefore called paleostriatum or pallidum. Globus pallidus has two parts, an outer part and an inner part. Substantia nigra. This right here is the substantia nigra. It is situated below the red nucleus. It is made up of large pigmented and small non-pigmented cells. The pigment contains high quantity of iron. Next is subthalamic nucleus of lice. Subthalamic nucleus is situated lateral to the red nucleus and dorsal to substantia nigra. This right here is the internal capsule. This is the putamen. This is the globus pallidus. This is the caudate nucleus. This one here is the substantia nigra. Now let's talk about the functions of basal ganglia. Basal ganglia form the part of extrapyramidal system, as I told earlier, which is concerned with the integration and regulation of motor activities. Various functions of basal ganglia are: number 1, control of muscle tone. Basal ganglia controls the muscle tone. The fact is, gamma motor neurons of spinal cord are responsible for development of tone in the muscles. Basal ganglia decreases the muscle tone by inhibiting this gamma motor neurons through descending inhibitory reticular system in brainstem. During the lesion of basal ganglia, muscle tone increases, leading to rigidity. Second function, control of motor activity, and it controls by various methods. Number 1, regulation of voluntary movements. Movements during voluntary motor activity are initiated by cerebral cortex. However, these movements are controlled by basal ganglia, which are in close association with cerebral cortex. During lesion of basal ganglia, the control mechanism is lost and so the movements become inaccurate. Basal ganglia control the motor activities because of the nervous circuits between the basal ganglia and other parts of the brain involved in motor activity. Neuronal circuits arise from three areas of the cerebral cortex, which are the premotor area, primary motor area, and supplementary motor area. All these fibers from cerebral cortex reach the caudate nucleus. From here, the fibers go to putamen. Some of the fibers from cerebral cortex goes directly putamen also. Putamen sends fibers to globus pallidus. Fibers from here runs towards the thalamus, subthalamic nucleus of lice, and substantia nigra. Subthalamic nucleus and substantia nigra are in turn projected into thalamus. Now, the fibers from thalamus are projected back into primary motor area and the other two parts, that is, premotor area and supplementary motor area. Regulation of conscious movements. Fibers between cerebral cortex and caudate nucleus are concerned with regulation of conscious movements. This function of basal ganglia is also known as cognitive control of activity. For example, when a stray dog barks at a man, immediately the person understands the situation, turns away, and starts running. Regulation of subconscious movements. Cortical fibers reaching putamen are directly concerned with regulation of some subconscious movements which take place during trained motor activities, that is, skilled activities such as writing, the learned alphabet, paper cutting, nail hammering, etc. Now let's see the control of reflex muscular activity. Some reflex muscular activities, particularly visual and labyrinthine reflexes, are important in maintaining the posture. Basal ganglia are responsible for the coordination and integration of impulses for these reflex activities. During lesion of basal ganglia, the postural movements, especially the visual and labyrinthine reflexes, become abnormal. These abnormal movements are associated with rigidity. Rigidity is because of loss of inhibitory influence from the cerebral cortex on spinal cord via basal ganglia. Control of automatic associated movements. Automatic associated movements are the movements in the body which take place along with some motor activities. Examples are the swing of the arms while walking, appropriate facial expressions while talking, or doing any work. Basal ganglia are responsible for the automatic associated movements. Lesion in basal ganglia causes absence of these automatic associated movements, resulting in poverty of movements. Face without appropriate expressions while doing any work is like mask-like face. Body without associated movements is called statue-like body. Role in arousal mechanism. Globus pallidus and red nucleus are involved in arousal mechanism because of their connections with reticular formation. Extensive lesion in globus pallidus causes drowsiness leading to sleep. Next is role of neurotransmitters in the function of basal ganglia. Functions of basal ganglia on motor activities are executed by some neurotransmitters released by nerve endings with basal ganglia. Following neurotransmitters are released in basal ganglia. Number 1. Dopamine, released by dopaminergic fibers from substantia nigra to corpus striatum. Deficiency of dopamine leads to Parkinsonism. Number 2 is gamma aminobutyric acid, otherwise GABA, secreted by intrinsic fibers of corpus striatum and substantia nigra. GABA is an inhibitory neurotransmitter. Acetylcholine, released by fibers from cerebral cortex to caudate nucleus and putamen. Substance P, released by fibers from globus pallidus reaching substantia nigra. Enkephalins, released by fibers from globus pallidus reaching substantia nigra. Number 6 is noradrenaline, secreted by fibers between basal ganglia and reticular formation. Number 7 is glutamic acid, secreted by fibers from subthalamic nucleus to globus pallidus and substantia nigra. Among these neurotransmitters, dopamine and GABA are inhibitory neurotransmitters. So, the fibers releasing dopamine and GABA are inhibitory fibers. All other neurotransmitters have excitatory function. Now let's talk about some applied physiologies related to basal ganglia. Number 1 is Parkinson disease. Parkinson disease is a slow, progressive degenerative disease of nervous system associated with destruction of brain cells which produce dopamine. It is also called Parkinsonism. Causes of Parkinson disease. Parkinson disease occurs due to lack of dopamine caused by damage of basal ganglia. It is mostly due to destruction of substantia nigra and nigrostriatal pathway which has dopaminergic fibers. Damage of basal ganglia usually occurs because of the following. Number 1 is viral infections of brain like encephalitis. Number 2 is cerebral arteriosclerosis. Number 3 is injury to basal ganglia. Number 4, destruction or removal of dopamine in basal ganglia. It occurs mostly due to long-term treatment with antihypertensive drugs like reserpine. Parkinsonism due to the drugs is known as drug-induced Parkinsonism. Unknown causes. Parkinsonism can occur because of the destruction of basal ganglia due to some unknown causes. This type of Parkinsonism is called idiopathic Parkinsonism. So these are some typical symptoms: masked face expressions, forward tilt of tongue, reduced arm swing, and also flexed elbow as well as wrist. This is the rigidity. In detail, signs and symptoms of Parkinson's disease. Tremor. In Parkinson's disease, the tremor occurs during rest, but it disappears while doing any work. So, it is called static tremor or resting tremor. It is also called drum beating tremor as the movements are similar to beating a drum. Thumb movements rhythmically over the index and middle fingers. These movements are called pill rolling movements. Slowness of movements. Over the time, movements start slowing down, otherwise called bradykinesia, and it takes a long time even to perform a simple task. Gradually, the patient becomes unable to initiate the voluntary activity. The condition is called akinesia, or the voluntary movements are reduced, called as hypokinesia. It is because of hypertonicity of the muscles. Poverty of movements. Poverty of movements is the loss of all automatic associated movements. Because of this, the body becomes statue-like. The face becomes mask-like due to absence of appropriate expressions like blinking and smiling. Rigidity. Stiffness of muscles occurs in limbs resulting in rigidity of limbs. The limbs become more rigid like pillars. The condition is called lead pipe rigidity. Gait. Gait refers to manner of walking. Gait in Parkinson's disease is called Festinant gait. The patient walks quickly in short steps by bending forward as if he is going to catch up the center of gravity. Speech problems. Many patients develop speech problems. They may speak very softly or sometimes rapidly. The words are repeated many times. Finally, the speech becomes slurred and they hesitate to speak. Emotional changes. The persons affected by Parkinson's disease are often upset emotionally. Dementia. In later stages, some patients develop dementia. This is how our basal ganglia looks like in early Parkinson and in advanced Parkinson. Treatment for Parkinson's disease. As Parkinson's disease is due to lack of dopamine caused by damage of dopaminergic fibers, it is treated by dopamine injection. Some of the symptoms of Parkinson's disease, such as tremor, are abolished by surgical destruction of basal ganglia or thalamic nuclei. Next is Wilson disease. Wilson disease is an inherited disorder characterized by excess of copper in the body tissues. It is also known as progressive hepatolenticular degeneration. This disease develops due to damage of the lenticular nucleus, particularly putamen. In Wilson disease, copper is deposited in the liver, brain, kidneys, and eyes. Copper deposits cause damage of tissues, and the affected organs stop functioning. In addition to symptoms of Parkinson's disease, liver failure and damage to the central nervous system are the most predominant effects of this disorder. Wilson disease is fatal if not treated early. Here you can observe the rim of the eyes. These are some of the disorders or the symptoms caused like CNS disorder, hepatomegaly, arthritis, copper accumulates in the tissues, renal tubular dysfunction, etc. Chorea. Chorea is an abnormal involuntary movement. Chorea means rapid jerky movements. It mostly involves the limbs. Chorea is due to lesion in caudate nucleus and putamen. Athetosis. Athetosis is another type of abnormal involuntary movement which refers to slow rhythmic and twisting movements. It is because of the lesion in caudate nucleus and putamen. Choreoathetosis. Choreoathetosis is the condition characterized by aimless involuntary muscular movements. It is due to combined effect of chorea and athetosis. Huntington chorea. Huntington disease is an inherited progressive neural disorder due to the degeneration of neurons secreting GABA in corpus striatum and substantia nigra. This disease starts mostly in middle age. It is characterized by chorea, hypotonia, and dementia. In severe cases, bilateral wasting of muscles occurs. It is otherwise called Huntington disease, chronic progressive chorea, degenerative chorea, or hereditary chorea. Hemibalismus. Hemibalismus is a disorder characterized by violent, involuntary, abnormal movements on the one side of the body involving mostly the arm. While walking, the arm swings widely. These movements are called the flinging movements. These movements are due to the release phenomenon because of the absence of inhibitory influence on movements. Hemibalismus occurs due to degeneration of subthalamic nucleus of lice. Kernicterus. Kernicterus is a form of brain damage in infants caused by severe jaundice. Basal ganglia are the mainly affected parts of brain. Here you can see bilirubin moves from bloodstream into brain tissue because in infants the blood-brain barriers are not well developed. Hope you have understood the video. Like, subscribe and press the bell button for more videos. Thank you. Thanks for watching.